you can start and have discussion, you
Okay.
can't take an action.
Right, correct.
Because you don't have the quorum. And then we do have a presentation from Bethany, so you may want to start.
We can start with that.
Great.
Okay, well then I'd like to call the meeting to order at 5:39. And first thing on the agenda here says public comment, but I don't see anyone from out of who's supposed to be here. We have the approval of minutes that were emailed to everybody who's on the commission.
We don't have a quorum,
Yeah,
so we
you
can't
can't
take
take
action.
action.
Okay, well, but read them if you haven't,
Yes.
because not everybody reads their email.
Hmm.
And now,
Madam Chair, you do have comment.
Oh,
Public comment
we
by
do.
Bethany.
oh, okay, well then, we call that comment when they do presentations. Hello, 1, 2, 3, go.
Good afternoon, and thank you all for having us here today. My name is Javier Garcia, and I'm the Director of Operations there at Bethany House. To my right is Ms. Judith Mena, who is one of our navigators, and to my left is Ms. Ana Chapa, who is also a navigator slash caseworker. Again, thank you all for allowing us to be here today, and for all you who are familiar with Bethany House, we have an array of services under our Bethany umbrella, which one of them is our shelter program services, where we have 28 beds for male and 22 beds for female. Along those lines, we have our meal program, where we serve 3 meals per day from Monday through Saturday. And on Sunday, we do serve our meals there at the shelter. We have emergency assistance, we have utility assistance, and also we have rent and deposit assistance through our rapid rehousing and our homeless prevention program. We have ongoing case management services where we assess individuals who walk through our doors on a daily basis. We also work through referrals for many of our agencies whom we collaborate with. We have SCAN present, and we have other agencies here. We do collaborate and receive these referrals through these agencies. So we're able to assess and determine what the needs are with the individuals coming in, or families with children that are being referred to Bethany House. So we have been blessed to be able to partner with the City of Laredo and Health Department through a navigation program which we initiated late last year. It has been ongoing, and we have seen some progress, and this is where Ms. Mena and Ms. Chapa come in, and through a referral process, they've been able to assess and determine what are the needs out there in our community as we speak today. We do have a percentage of these cases coming in, which we have been able to highlight housing needs, number one. Number two, we've been able to highlight mental health needs. Number three, we've been able to highlight co-occurring needs, which are the mental health and substance abuse. To date, we've seen over 200 clients which have been assessed and have been referred out to SCAN, number one, number two, MHMR, Border Region, Pillar. We have a percentage of cases which have been referred to City of Laredo Health Department through their HIV program, through their Zika program, through their TB program, hepatitis C program, and ongoing. We have seen some progress through some of these cases, and we have seen a percentage of the cases that are very complex, very challenging, but it's an ongoing challenge, and it's an ongoing treatment, and this is where our navigators have been able to come in and assess these cases coming in and provide that intensive case management and follow-up. We have made a determination where we have seen some breakdown in services which occurs during the follow-up process. And I do want to highlight that as we speak, we're here right now, but as we speak, there are a percentage of cases on that include homeless individuals who have the co-occurring, the substance abuse, who are under our outreach program and are right now currently on Man Road, on Del Mar, on Calton Road, on Lafayette. This is where we have been able to come in and assess these needs and address them, and collaborate with you all, and kind of start working with them, because the substance abuse right now, I can outline 23 of our cases that are under our outreach program, and 85% of those cases of our outreach are substance abuse, mental health. Of those 85%, 37% are heroin IV users. And these cases have required extensive case management, and Mr. Manrique is here today, and through his program, which is the Hogar para Todos program, we've been able to provide those extensive services. And as we speak, we have ongoing focus groups on Thursdays and Fridays, and we have caseworkers through their program who are there at our agency on a daily basis to be able to provide these extensive services. But we do recognize the extensive need for substance abuse services out in our community, and if Ms. Mena would like to add anything to, or Ms. Chapa, go right ahead.
Well, the majority of the reason why they can't, a lot of the clients that they can't move forward, unfortunately, is drug abuse, and it's coming from a long pattern of, from a cycle of family, and it's hard for them just to reach out to us to say, you know what, I need help. And then again, when we do try to assist them, some of them don't fall, they fall through the cracks because of one issue or another. They really can't move forward. It was just, I need the help, and they need the help like right now. And unfortunately, we have to refer them out to Charlie's place, which is in Corpus, and that'll take, at least 2 to 3 days sometimes to get somebody to get them there. By that time already, they withdrew their wanting to, get detox. So we definitely need something here in the radar to, help them out like immediately. We gotta take that opportunity to, seize the moment, basically. I want the help, and okay, you're gonna get the help right now.
So for example, today we had a Brian, a 21-year-old individual who we were working with day in and day out. This is a chronic young man who we had been trying to get motivated. He walked in our offices by himself. He said, and we're glad he did that. I'm tired, I'm fed up, I haven't slept. I'm close to probably ODing. So our process was, he was able to see one of our navigators. We determined his need, and our next step is to work with SCAN. We work with Rudy Bice, Mr. Bice, through Ozar. But basically, our goal is to get him detox, and after the detox, where we have seen a breakdown is after the release from Charlie's, the communication has broken down. They're in Corpus, and it just breaks down. We have a percentage of them who stay in the sobriety homes there in Corpus. They stay in the sobriety homes 40 to 45 days. We find out that some make their way back to Laredo. It doesn't help that they come back to our area around Bethany, because the temptation is there, the drug is there. I'm very frank with them. I say, Javier, you're gonna walk out there, and Jose is there, te va a ofrecer, he's gonna. That's the reality of the issue downtown. And I want to say that in the last 6 weeks, we have seen overdoses of heroin. It is a big issue right now within our radius there at Bethany House. We collaborate closely with Laredo Police Department, Sergeant Baker, his team, and then you know, other agencies that are in the picture, and I'm happy for that. But in the last 6 weeks, and Captain Martinez, I was talking to Benito Martinez yesterday, and in the last 6 weeks, let alone an incident that happened on Sunday with a Christopher, and I'm glad that nobody got hurt, but he said he just went on a rampage, and he became very violent and aggressive, but he was able to be restrained. He has been on heroin for quite a long time, but it seems to be on the rise tremendously. And for example, this Brian kid, he's 21 years old, and I spoke to him and I said, you're making the right decision. I'm hoping you stick to it. We will provide the support system. It's not only Bethany, it's a team. So, I'm glad we're able to be here today, and we want to let you know that our doors are open to any solutions we can be a part of. I do want to definitely highlight Judy and Anna, because they have been able to work like in a more extensive, I want to say manner, style, but we're all here today, and we've all been there, and I've known Jesse for some time since we opened up our shelter back in 2006 with Mr. Ceballos, but the issue right now out in the streets, it's a big problem, and I had, within the last 3 weeks, some overdoses, and I can name the first names, but we'll continue to work diligently, and I'm glad we were here today, and thank you, Dr. Gonzalez, and thank you all of you. If y'all have any questions for us, all our clients walking in are our families, our children. They're being inputted into a data system. It's called Homeless Management Information System. This is a requirement by HUD. All shelters, homeless shelters, are being required because of the grant that they provide to us, the Emergency Solutions Grant. We are required to input all this data into this system, and then basically from there we work through goals, addressing the needs, through referrals, and basically work with all the outlying agencies that we work with day in and day out. So,
Madam Chair, if I can just to highlight, and Bethany does a great job in working with anyone who comes to their doors, but definitely the homeless population, that many times, if it wasn't for them, they get no support. And then the navigators have done a great job in channeling them to the service, but it highlights what you all have been discussing as commission members, excuse me, the increase in opioid use. We just finished our data of deaths for 2018, and we had 38 overdose deaths, mostly opioid. In 2017, the most we have had in 5 years, we had 44. For our population, that's a big disparity. We should not be, no one should die of an overdose, but to have that number, 44 in 2017, 38 in 2018, that's too many. And it's because we do have an increase of use. I'm sorry, Jesse, you were gonna say something?
Well, I was gonna ask some questions about Javier, for Javier. You mentioned 200 individuals. Are those the individuals that you've seen this fiscal year from September 30th or October 1st on?
from October 1st on, and within those 200 plus, the needs are not all substance.
No.
It's just the housing component, mental health.
Exactly.
Substance, yes, sir.
And then how many of those then were referred to SCAN's treatment component? Out of that, you mentioned a percentage that had gone, because of those 200, not all of them were identified. You said there was 97 or something that were identified, I forget the number, as having co-occurring issues.
Yes.
What was that number again?
Well, from the 200 plus that have been assessed through our navigators, there are 23 active participants in
20.
our outreach.
And 23 in the outreach.
Out of the 23, 85% are co-occurring.
Okay, and those 23 that are out, because you have the outreach component where everybody's working and there's 200 that have been referred, and you have 23 active and they're receiving services from SCAN, is that correct?
Not only SCAN, but other.
Right, but they're receiving some type of treatment
Yes.
services. Okay, and that's where you said that 37% of those 23 were opioid.
Yes.
Okay.
And the issue here is the consistency of trying to have them, it's just, it breaks down because being that they're homeless, we visit with them as much as we can and motivate Javier to be able to attend his appointment, whether it's in-house or we attend to him out on the street, but we lose them at times and for X number of reasons, and we just continue, it's just an option.
It's the most difficult population. If you think
Yes, sir.
about it, the homeless,
Yes, yes.
basic need, and then you're having the people that have the co-occurring issues, you know, they all have mental health issues,
Yes, sir.
if they've been displaced, so it's a very difficult population. Huh? And I would imagine that goes with the statistics that we have, for when we did the race and barriers and then the drug court and veterans court, which shows about 25 to 26% opioid use, historically over the last 12 years or so.
Thank you very much, and we do have Ms. Sanchez here for a quorum. Thank you for attending. We were waiting on you, but we,
Sorry, I was.
that's fine. We thought, well, let's get Bethany and to explain what they're doing, and it's a very good job. It sounds really,
Thank you so much for what you do.
really a lot of experiences for the navigators.
Mhm.
Considering that we have a quorum, I'd like to make a motion to accept the minutes, to approve the minutes as presented.
Thank you, of course. We were all sent them by email. We got the meeting minutes for last meeting, so I need a motion to approve.
Oh, I made a motion. We need a
Okay, second?
Second.
Anyone opposed? Called for the question? Anyone opposed? I didn't think so. Okay,
All in favor?
yeah. Call for the question, yes. That's what it is. All right. So the ones that are voting said aye. Anyone not approve? Motion
No.
passes. Okay, discussion and possible action, update detox facility and other work groups.
We'll also report on the detox.
We've been meeting pretty regularly. I think we've met at least three times, all of us. And there was one where there was only four, and there was about two times we didn't meet. But where we ended up was, let's figure out the days, because some days didn't work, and then we'll talk about what we specifically did. One of the last suggestions was to meet, on Mondays at about 1:15, 1:30. And then on every other Wednesday when we had this meeting for the hour before, so we here at 4:30. That way, hopefully we can get more consistent people showing up. We worked on, we looked at the square footage, what it would take for the facility, looked at the standards. We looked at how much it would cost for the staffing, right? And the last thing we ended up on was, that, we wanted to look at the
original plan.
At the original plans, we felt that if you could look at the original plans, then we would be able to get an idea and come up with some, sort of
Ballpark
Ballpark.
figure in accordance with the Texas Administrative Code
Yeah.
requirements.
Exactly.
Okay, before we go out getting our Q-techs and all kinds of stuff, just to get an idea.
And, you know, we do know, based on what we've seen, that we're gonna have to knock down some walls, right? But,
Okay, so, yes, we were looking at the units that are
The
there, knocking
units.
the wall down, and there's a require, yes, but I think it's 60 square foot per person,
Right.
unless you have a bunk bed, and then you only need 50.
Right, and we were short, right?
Yes, but if you remove the wall,
Will be
it
perfect.
should, perfect.
So, you know, in wherever there's, two, pods together, we knocked out the idea would be to knock out the wall in between. Right, and I think, you know, Everett has enough experience.
Yeah,
to-
nurse's station would be that,
Yeah.
the one glass area.
So,
There's plenty of rooms for examination rooms.
and we actually have some big rooms that we don't have to do anything with, that could be for, crisis stabilization after you do the detox, you know, as you're walking out. There's a number of big rooms, where it's just open space, and you could have people for crisis stabilization, so after you do the detox, and some people can stay there a little bit longer until they're more stabilized. So we have some room that's possible, and I think we'd still be looking at, because there's 32 pods, right?
Yeah.
So that we would still be looking at 32 people.
That was my next question, so.
That, you know, because, and then we can have, let's say, you know, if we ever got to the point where we had that full and we had it fully staffed, we could do 32, we could still have some people in crisis stabilization based on those big rooms that are both in the male and the female areas. So there's a possibility to do a lot of stuff, you know, for relatively a small sum of money compared to building a new building.
Right.
And work on the facade
Yeah,
outside, you know.
exactly.
If you order, because earlier you said you want the layout, right, the blueprint.
The original blueprints, I know.
What I can do is, I work with the county, I
Okay.
can send an email to civil engineering and planning to see if they have them. Somebody has to have.
Yes.
Now, is it structurally feasible to do so that?
Well, we won't know until we get the original,
I mean, considering that it's made out of concrete block,
Mhm.
all the walls are load bearing. You know, so,
well, we won't know until we have the original plans, I know where, how the
Okay.
structure was.
Well, Madam Chair, Mr. Ramirez is gonna, contact civil engineering on the county side. We have contacted, the judge's office, and, Nancy Cadena from Energy Care has helped us also to try to get them from the judge's office, so they know, and they're working on that. I think if we contact civil engineering, Mr. Ramirez was offered, you know, we can get them quicker, cause city council Monday voted to move quickly on the RFQ.
Good.
They are committed to continue this, and so is the county, and I've met with one of the county attorney, their attorney Nathan Bratton, to develop the interlocal between city and county, but that's the formality. We can still issue the RFQ, but anything we can give them on details and conceptual design will guide them, but also that's their job. Whoever answers the RFQ, we do need to
Okay.
put some information, some basic information, the structure, the size, the rooms, some of the info you just gave, I think will be critical.
I would think that because if there were a situation where we couldn't break down the walls, the next step is to use what we have there while we decide what to do, because we have the two big rooms where you could have all of the people in open space with the nurses there, and, you know, we would still be able to serve people because it's a big open room. And so the next phase would say, okay, well, let's scrap this idea, but use these two areas in the meantime while we decide what we're gonna do and possibly build something outside. So the idea that Dr. Martinez had, through Judge Hale, and said, let's go ahead and do something right away, well, I believe it can be done in that way. We couldn't do that.
Absolutely, but let's go back to,
The plan, the money.
yeah.
Yeah, so, I mean, the reality is that we talked about this. You're gonna, the county and the city are gonna have to come up with some initial money, or the county, city, and the hospitals, however you all wanna break it up. But there's gonna be a need for anywhere from 250 to 300,000, maybe, or maybe less, I don't know.
Well, let's
I'm
start
not-
with it.
To start initial
Yeah,
services.
well, no, not to start the initial services, to build, to do the remodeling.
Right.
yeah,
Well,
Just to
and-
begin.
and
get it to spec.
The Madam Chair, again, the director council Monday is exactly that, and to start looking at resources on the city side. My earlier discussion with the county attorney, told him the same thing, county has to come up with some. And then we have a meeting in 2 weeks with one hospital, and then with the next one to see. Now, we've spoken, the mayor and I have spoken to both hospitals, and they have said, yes, count us in, but now we need to say, okay, how much? And I think if an initial cost to start some of the remodeling, some of the fixing the rooms for initial, if we're talking about $300,000-400,000, you can split it 4 ways.
4 ways, yeah, we did have that discussion. I mean, if you really think about it, if the county gave $500,000 to remodel what we call the drug treatment center for the Webb County Drug Court and the Webb County Veterans Court, it cost $500,000 to remodel all that part, get the air conditioning ready and get the offices ready. I mean, that's.
Was that through
But-
grants or was that?
No, that was money that the county.
Well, but at that time, oil and gas was way.
Yeah,
Yeah.
oil and gas was
Yeah.
way up, so they could actually give $500,000. That was with the previous judge.
What about inviting the hospitals to our meetings? Would that be a good decision to get them involved now?
Madam Chair, I think Nancy said, that's exactly, they wanted to have an initial meeting first with the mayor, and I think we need to invite the judge too, both of them to sit down, and then bring them here as well. But we can always invite them
Yes.
to come to the commission meetings and meet you all and hear from you. I think the critical meeting that we're setting up with both mayor and judge, for them to recommit and know that everyone's gonna have to put a part in, is critical. But we can invite them if the commission wants to for the next meeting.
Excuse me, I don't know if, Border Region would, be willing to donate something since, you know, a lot of the residents would be newly diagnosed with mental illness and substance use. So it would be to their benefit to
Right.
probably, be involved in one way or another.
And
I don't know if they have the
Madam
funds.
Chair, that's another good point, and we have scanned here today, and I think Gateway. But in the past meetings, once this gets going, then the services that are being provided for residential and treatment, if there's any piggybacking that can be done, I think all the agencies said yes, but right now, most of the resources are for the actual services that
Yeah.
they provide.
Yeah, I don't think MHMR, none of the grants that any of the nonprofits work for allow for funding the
To-
bills,
yeah.
for anything. And we're gonna need them for services.
For services.
Or to
yeah.
donate.
That's gonna be their piece of the puzzle, to provide the services and to make sure that we have that, you know, the hospitals can provide money so we can have some nurses and whatever else we need to staff, and they can split it, but we have that initial cost. How are we gonna get there? How are we gonna remodel this place, or how are we gonna build new ones?
If they wanna go as fast as that we can, then the faster we can is money.
And that's why, Madam Chair, this meeting is crucial, because we need to have a hard commitment. City, county, and the two hospitals primarily, but.
Well, if they can't come at this hour, because usually you're not gonna get the mayor and the judge to come at 5:30, let's change our meeting to earlier. For them, just that one time, right?
Yeah, I agree.
Yeah.
Because they're not gonna come at 5:30.
Well, to get the mayor, city manager, and the county judge, as well as the hospital administrators. I'd like
Yes.
to, you know, because the last time we had the hospital administrators there, and they had bought in early on.
And again, specifically, I've already spoken directly on this topic to Jim Resendez, the CEO of Doctors, and his response, tell me the meeting so we can discuss
Okay.
the details, and I'll be there. I need to get Enrique Gallegos now from LMC to do the same thing. But in the past, the past two CEOs, they were at the table. The same, this is beneficial for them.
For them, no,
just-
they were.
Just, if you just look at the business side of this is one of their high-ticket, uncompensated care issues. And so, let me tell you,
No, they're gonna be on the table, that I know. I mean,
they're gonna
I
be at
think
the table.
Steve was the CEO way back in 2013, and he got from LMC, and he was.
And these two new CEOs, Enrique Gallegos from LMC and Jim Facendas from Doctors, are very community committed, very community oriented, so.
Good.
I don't think it's a problem, it's coming to an agreement, how much are we talking about, who's gonna give what? Because they're also businessmen, so.
Well,
they wanna know.
and I guess that's why it would be crucial for them to have a discussion, you know, or be in a discussion so we could understand.
Well, I'll see when the judge and mayor are available to see
Start with them, yes.
and schedule and
Give them 7
invite
days.
you all.
Mhm.
And so it can be a general meeting,
And at whatever time they can, we'll have to,
because what we did, the meeting times last time were between 10 and 12 in the
Yeah,
morning.
That works.
as a
Usually-
matter of fact, it was around lunchtime,
Right.
because they would bring in our lunch, it might have been
Right.
from 11 to 1.
Yeah,
And because they would bring us a Subway and stuff like that.
right.
Mm.
Well,
Well-
we'll schedule it and let all the commission members know as well, and all the partners and stakeholders as well.
okay, I do have one request. What is RFQ, so that we can all understand what RFQ, don't give me, acronyms. Tell me what it means.
Request for qualifications,
Thank you.
so they can
I
submit
just-
their concept
Okay.
of what to build and remodel or
Okay.
retrofit the.
Oh, we need the
place.
blueprints.
Yeah, I already have it done.
Great. All right.
But I don't have anybody's email, or do I just respond to you?
You can
How
respond
did-
to the chair, but if you respond to the email
Yeah.
telling you about this
I
meeting,
saw your
everybody's there.
email
Everybody's
responding, so
Everybody's
you
there.
responded to the email, and I said, oh, Javier's coming.
Just
Because
reply
I
all.
saw your
Yeah, you
email.
see it, yeah, reply all.
Just reply all, because
Reply
all
all.
our emails are
Okay.
there,
And then
The
you
only
can
one
see
that,
each one
bounces
individually if you
back
open it up.
when I send it is
You'll know who it
Colleen.
is.
on mine.
When I sleep,
I never get anything from you.
you don't get anything from me? I get yours, but Colleen's bounces, I always get an error.
It's AT&T. I know they do have AT&T. Okay, then, that's the update on A. What about B? It's the same thing, we just talked about it. Update on county and city partnership,
Yes.
we just talked about it.
Yeah, I just gave you that update, and so we're moving forward, both the county and the city are committed, and, Nancy, one question, and that, the judge asked me, and I told her to talk to you and Nathan, the county attorney, is there some flexibility with the 1115 county dollars that could be put on the table? You don't have to answer now, I'm just saying,
Yeah, we have to
Nathan-
look
Nathan
at
asked
what's
that.
available, but I'm sure that we could find some money there.
okay,
And then like right now, the county's gonna be working on their budget, so it's a good time to start looking to the budget officers, because it's gonna be harder after October for them.
Well, the taxes are going up, so they should have more money.
The reason Nancy oversees a special project, that's a match project with the state. The hospital, the county is the administrative agency, but several of us participate in providing care for indigent services. The hospitals, the health department is one, Border Region is another partner, and so Nathan was the one, Nathan Bratton was the one who had asked me, I said, you need to talk to Nancy to see.
Okay.
Oh, I wanted to mention that, I've been out of town, so I haven't started on the transition living, but I'll be starting that in May.
Okay, and Stephen, would you give the report on our meeting with Colleen and our,
Okay, the awareness committee meeting, we met at the Crime Stoppers office, and we were discussing possible events and actions that we could do for April. But we're already past the halfway point of April, so those things didn't come into fruition. Ms. Rodriguez has some very good ideas that I mean, we can still implement. We just wanted to do it during April, which was alcohol awareness, Alcoholism Awareness Month. So what she wanted to do was get a bunch of stakeholders and, probably have something, an event at the mall where everybody could have a booth, sort of like a health fair, pass out information and stuff like that. We just wanted to jump on the fact that it was April. You know, like I said, we're already past the halfway point, so, I mean, I don't see it now, especially, you know, with the Easter holiday, and then after that, you know, we're
Yes.
going into May perhaps.
Maybe you can wait for recovery month, I think it's sometime in the early fall. You know,
October.
recovery awareness and it can be planned, you know.
Well, let's just do something every month, if we
Yeah.
can.
Yeah, that was another part of the discussion, is that perhaps we could do something different every month, is to generate, awareness.
Yeah.
Even if it's
for the different
PSAs.
types of-
Well, I think the PSAs would be great, I mean,
Mhm.
those run every night, just to let them know.
Yeah, I think,
Just to let them know what Dr. Dr. Gonzalez said, you know, in 2018, we've had, 38 overdoses, we had 44. The total, since we
Statistics.
kept track, I have them somewhere, but I have them only in 2017, but somebody can go out and do that PSA. And that one can run consistently and say, like, every day somebody's overdosing, and,
And a very frank one would be something like, yeah, everybody listens to statistics until it's someone you know.
Yeah.
Right.
Your
Yeah.
family.
It's
Madam
all-
Chair, we can explore the PSA, but again, you all have a Facebook page and it's
Mhm.
getting hits.
Oh,
So short of a public proclamation or fair with booths, messages, we can put them on Facebook, we can put
What's
them in
the-
the cities, we can put them on the health departments.
That's
and
ongoing?
Share with all the partners.
As a
They all
matter of
have
fact,
to put
yesterday,
pictures.
something was shared about the alcohol awareness, and, one of the things that, that Colleen Sodias was suggesting is that she wanted to highlight all the stakeholders and create some sort of PSA around that, so people can be aware of the services that we do have here in Laredo.
Mhm.
A lot of people don't realize or don't even know that we have these services here,
Yeah.
so they don't reach out,
So
for
you-
a relative, a loved one or somebody they
Right.
care about, because they don't know. They don't
She
have
is
any
planning
idea
on
what's
that.
out
She's going to be hitting on all of you to be in the PSAs separately, ¿verdad?
Yeah.
One at a time, and explain what it is that your programs do.
So it's a one-stop shop.
there's a movement called shatterproof.org. It's a national movement.
Mhm.
If anybody has a chance to look at it, it's been around 6 years. And everything y'all are talking about right now, it's all there.
It's already being
Go
done.
through all the drop downs and,
Okay.
it's about removing the stigma of addiction,
Mm.
the shame and guilt, that goes along with it.
And do they let you
Yes,
use them?
Absolutely, and,
Perfect.
they even show you how to have fundraisers, for the community awareness, shatterproof.org.
That's great, because, we're not here to try and reinvent the wheel.
Guys,
that's
look at it,
right.
and everything you all are talking about right now, it's all there.
Yeah.
It's put very.
But still, I would like to highlight our local stakeholders and start that way. And we've already been allowed to use, we have to show up over at Civic Center, what's that little place where they do
Public
the
access.
public access?
They're here.
Oh, they moved here?
No, they're.
Oh, he's here, yes.
That's the taping, and I can
Yes.
tell you.
Careful what we say about public access.
No, Madam Chair, they do a great job today.
Yes.
The Blue Ribbon Committee for People with Disabilities that I also facilitate for the city, they previewed and Public Access did some real nice PSAs.
Yeah.
On hiring people with disabilities
Mhm.
and breaking the stigma about why people don't.
Yeah.
And they came out real nice, so that was the concept that you all wanted to do now
Yeah.
with,
Yes.
with addiction, the same
Right.
thing. And the education committee wanted to go one by one to the stakeholders and
That's what we're
highlight what
doing,
they're-
yes.
what they do, go to SCAN, go to Board of Region, go to Pillar, and on behalf of the commission, highlight to the city, because a lot of folks don't know.
Yeah.
Mhm, mhm.
So we can do that, we just need to, you just tell us when you're ready to go.
So Colleen's working on, she was getting already in touch with them, so we don't want to step on toes.
Until we meet again with her, when we have another meeting. At our
Well,
next
it's
meeting, we can-
almost next month.
so,
Well, especially anybody that deals with people that have gone to jail, so that the
Yeah,
parents
just
know
go
when,
first.
where, officers and judges and prosecutors, defense, know where to send people, cause I remember when I was in the Odyssey, I'm still in the Odyssey. You know, she's back from treatment and back again, so if don't have transition, then it's just not gonna work.
Okay, what else?
Since you're all ready, let us know and we can coordinate with public access.
All right, so we had already the prevention outreach education, and we had the detox. Who else is going to be doing intervention, treatment, and rehabilitation?
I don't think the other two groups are met.
They haven't met yet?
Yeah, we haven't met, transition has not met.
Okay.
We're gonna
I
meet
have
in
to
May.
excuse myself, I'll see you all soon.
Yes, thank you.
Bye, Nancy.
Bye-bye.
Blueprints.
Oh, yes. I'll email you all in the morning.
Thank you, everybody's working on it, thank you, sir, you too. All right, then, if the other two haven't met, we'll wait for next month's, meeting. But Stephen also had another idea about our meetings, you wanna go ahead and present?
Yes, I want to bring up, that, hindsight is always 20/20.
Mhm.
And I think that at the last meeting, we kind of jumped the gun a little bit in wanting to meet twice a month. As we saw the first month that we were gonna do it, it didn't pan out. The committee meetings, although, like you guys have met several times, right?
Yeah.
And we met one time already, and the other ones are, anxious to meet. That if we keep that in place, but go back to the original once a month for the entire commission, versus trying to do it twice a month. I think it'd be a bigger burden, but if we break it down to the committees.
Especially for
And then
detox.
have the committees where we can redesign the agenda, to just then have reports from the committees, which are meeting more often, and then just go back to the once a month for the commission.
I
Sounds
agree.
like a good idea,
Sounds like
cause
a
you
good
guys
idea.
are overwhelmed with meetings,
Yeah.
I think. But if you don't mind coming 6 times to the to the,
So I'll use
Well,
that.
I think there's
that.
more work to do up front on this, that's the thing.
Mhm.
Yeah, it'll give you work, I mean.
That's
time
why
to
we
work.
think that it should be more meetings with your own
Individual groups,
Substance.
groups, yes.
and the ones a meet.
Because that allows the group as a whole to focus on specific areas
agree
and then
with
bring
that.
them together at the general meeting.
Madam Chair, if you go back to the ones for the full, would you be willing though to come as other meetings come up, like this meeting with the hospitals and the
Yes,
judges?
of course.
absolutely.
Those will not,
Yeah.
probably will not be
Mhm.
at your regular meeting.
No, those are special meetings.
You
So-
just call them special
Okay.
called meeting. All
Well,
right.
that being said, then I'll make a motion to revert back to the meeting once a month, which is what, the second Wednesday of each month? Or when was the original?
The
First
first
Wednesday
Wednesday
of each month
Each month.
Right,
at 5:30 to 6:30,
yeah.
with other meetings to be determined at a given time, will be called as special meetings.
So then our next meeting will be within 2 weeks, more or less.
Yes.
So do May the first?
First Wednesday of the
First
month.
Wednesday of each month. I'm looking
Of the
at it
month.
right now. Yes, it'll be May the first.
Now, y'all gotta take into consideration that this meeting was rescheduled because we didn't have the last one.
Well, actually, we're gonna have 2, anyway.
And we were gonna have.
This was
two.
the second one,
This would have been the second one.
yes.
And
So-
when
I was out
will
of
it
town,
be
I
here?
have been covering
Yes.
it, I've been out.
I was at a conference.
Yeah.
All right, so then we move it to May 1st?
May 1st
Or,
is your next
or would you
meeting.
rather do May 17th and give the different work groups time,
That's up to you.
work
all.
group time to meet?
It's up to you.
I think they've been
No, I
meeting
think we
anyway.
stick with
Yeah,
the,
May first.
first
Okay.
Wednesday, not deviate from that.
That's fine.
Unless it's a special meeting,
And then we show
have to,
up.
We'll do a special meeting,
Whoever can manage and get out of work.
and we need to catch up with them, because they've been having meetings like crazy.
Mhm.
I guess,
Every week, they have a meeting every week.
I'll second your motion.
Yeah,
Okay, we got a
second.
first and a second. Call for the question, all in favor?
Aye.
Aye.
Anyone opposed? Motion passes.
Okay. I do have a question, I guess, the ones that are coming to the detox meeting, the only other person I see here is Ike. Is there anyone else? Because we at least have we made a proposal to come on Mondays at 1:15 to 1:30, and then every other Wednesday before this meeting, but now since we're only meeting once a month, how does Mondays at 1:15 or 1:30 work for you? And then that way we can just, if that works okay for you?
That works fine.
That works okay for me. We're coming at a time that was just not available. But, how does that sound? And if you're okay with that, then we can just send the meeting to the whole detox group and say, y'all weren't here, but we agreed to meet on Mondays at 1:15 here at the
Yes.
city.
I
would like to be included in the detox and the treatment.
Okay, that's fine.
treatment.
Is 1:15 okay for you? On Mondays, 1:15 okay with you, Deacon? All right, you know, so,
It is challenging, I didn't say it, because I do oversee
I-
various programs for the agency, but I make accommodations, so.
all right. Well, you know, if not, just send your second. You know, send.
Yeah, there's two of us, so
Yeah.
definitely.
Yeah, because, I saw, Gabby here the other day, so either one.
And Mr. Montemayor, and so that's four
Yes,
that decided yes.
Yeah, so that's four, we can do it, and then we'll just send it out to everybody else and say, we're gonna meet on Monday.
We'll send it to the work group.
Except not this Monday, because Easter Monday, right?
Right, no, not Easter
Please.
Monday.
Not on Easter Monday.
And I think it should be said that we do appreciate, you know, the work and the effort that you try to get, like trying to accommodate for these meetings and everything.
And work.
In order to accomplish our goal. And I personally wanna thank each and every one of you for the work that you do and the time that you put into it.
Well, you know, I appreciate that, Steve, but you also do a lot for the community. You know, I know that you're out there, I know what you do, and so, you know, appreciate you, and of course, everybody else, we all do our bit.
Okay. All right, then we've got it all together here. Staff and stakeholder updates, anybody besides Bethany? We appreciate Bethany coming over, and you can continue to come back and give us updates on how your new navigators are doing. I'll be praying for you.
And we do, if I may, we do have a transitional setting there where we have 17 units, so any input that we, you know, can contribute, then let us know, and, you know, we have an open door policy, but we do have families on a transitional setting, so, on case management and they're there on ongoing treatment also, so let us know.
Just a side note, you know, I supervise counselors, and the day during, supervision, one of the cases that came up was a client that's at the Bethany House, heroin addict and some problems, and I heard a lot of good things about the coordination, and the counselor was talking about the work that you all do, so that's very positive, so, you know, the counselors, and these are counselors that are working not just with Pillar for a reason, because I work with counselors from Pillar. I do their supervision, counselors from the drug court, the veteran court in Pillar. So you've got some other counselors out there that appreciate what you do.
Madam Chair,
Thank you.
quick announcement. I had already sent it out to everyone. May not have gone to Bethany, we'll send it out. We partnered with UT Health San Antonio. With the nursing school, they're gonna be providing a two-session opioid 101, and some of you already reviewed. We'll send it out again. It's a 2-hour training on very basic on opioid, what the problem is in recovery. We have a second one in May. This is for clinicians. We're applying to get more doctors to treat with buprenorphine for addiction. You have to be certified, but this is with the medical school from San Antonio, and they're bringing their staff to work. We have anyone can come for the awareness, but we want the clinicians to come, the doctors, the mid-levels, the psychiatrists, because then they'll, after this, one, they get medical education units, but two, they get the awareness and the packet to go online after they've gone through that one will be a 4-hour training.
Have you included not only the buprenorphine, but Vivitrol? You know, because I think that ought to be in the packet. I think we ought to using Vivitrol, especially now since the state has a block grant for MAT.
This is the same thing, medical assistance.
Yes, right, so MAT, but, for efficacy purposes, I like Vivitrol better than buprenorphine, based on what I've seen.
But it'll cover both, it should cover both, but it's medical
It's gonna be
assistance.
MAT.
It's
Just
gonna be
MAT total.
MAT. And that's on May 17th and 18th, a Friday and a Saturday. Again, the focus is clinicians, because they have to prescribe it, but like the commission members are welcome to come, and I'll send that out because they'll cover all the information about the treatment side and the stigma side as well.
You know, for LPCs, if you could include CEUs for LPCs or LCDs, you probably have more people attend. And those are the clinicians that are really on the front line but,
Well,
you know.
he asked, that they're gonna come back, that it's a state project.
Right.
From the state opioid, project, and so they wanna get more, we don't have enough, Laredo.
We don't have enough
Right.
doctors, I mean, we don't,
To
that I
treat.
know of, the 2 doctors that do buprenorphine, because it is controlled by DEA, and one that does Vivitrol, and so we just don't have it, and then we have the methadone.
Going through the state-approved curriculum, because it's a state grant that the
Yeah.
medical school got from San Antonio, then you get a waiver, you apply for the waiver online, the physician or the one who has the license to prescribe, and you're able to do that. Our intent was to create at least a dozen physicians. Right now, I only thought we had 2.
Well, we only have 2.
Yeah.
We only have 2, and then one that does Vivitrol, Arturo Garza-Gomez, he does Vivitrol.
Right.
So then that's 3 total using MAT plus methadone.
Because if we get more physicians.
Acronyms.
And medically, and medication assisted.
Assisted treatment.
Medication assisted.
That's
And
what
the other one
matters.
you were saying CUs?
CUs, continuing
Any
education.
medical education units, yeah.
Okay.
So, yeah.
And they needed,
We
We
need a
don't, we
guy.
don't know
Yeah,
that.
I need a
legal.
guide,
I
yeah.
know, we
the
need a
medical is
legal-
for the physicians and they need it for their license, and the continuing is for others who have, like, the licensed professional counselor, anyone who has a state certificate or license that needs
To renew it.
to renew it, they need continuing education.
Right. Okay, so that's 17th and 18th?
Yes, and I'll send it out again to.
And the other
May-
one?
May 17th?
The other one,
May.
the medical assistance treatment is May 17th and 18th, Friday and Saturday, that's 4 hours.
4 hours. Okay.
The opioid 2-hour program is, I think, April 30th. But I'll send it out again. I'll send it
Okay.
out to the commission members.
Okay. That air conditioner is doing a number on my allergies.
Yeah.
Okay. Are there any other announcements? All right, then, do we have a call for adjournment?
Motion to adjourn.
Have a motion? Second? Call for the question, all in favor? Anyone opposed? Didn't think so. Meeting adjourned.
Thank you.
Thank you.